The U.S. Supreme Court heard one of the biggest abortion cases since Dobbs. And the case has the potential to decide whether states can withhold Medicaid funds from abortion providers like Planned Parenthood. Here to share more about what happened at the Supreme Court today is Chris Schandevel, who is one of the Alliance Defending Freedom senior counsels on their appellate advocacy team. ADF represents the petitioner in this case, which is South Carolina's Department of Health and Human Services. Chris, welcome back to Washington Watch. Thanks for joining us.
Sure. Thanks so much for having me on.
All right, so let me start with this, your overall take of the oral arguments today before the court.
Sure. So we feel very good coming out of oral argument today. My boss, John Bursch, argued the case on behalf of South Carolina's Director of its Health and Human Services, did a fantastic job, as we all knew he would. I was privileged to get to sit second chair, so right by his side there in the courtroom, had a front row seat to see all the justices interacting with John and asking him questions, asking really hard questions of the other side. And what became very clear very quickly is that the justices whose votes we need to prevail in this case clearly understand how important it is for the court to speak clearly and issue an opinion that makes clear that if Congress is going to impose requirements on states as a condition for them accepting Medicaid funding, that they could be dragged into federal court and have to defend against these really costly federal lawsuits, that Congress needs to speak with a very clear voice. And the justices on the court seem to understand very well how important that is to the states, how important it is to South Carolina, our client in this case. And so we feel very good about the kinds of questions the justices were asking and how well our arguments were received.
Chris, just to put this kind of in context for our viewers and listeners to know the scope of this is not just about Planned Parenthood. I mean, this case is about them, but the implications of a decision could be far-reaching. I mean, you've got probably 9,000 disqualified Medicaid providers out there in the system, and depending on how this case goes, they could each sue or they could have a consumer sue saying they've been denied a service from one of these and take a state to court.
That's right, and that actually came up during the argument today about how it would really be just absurd to think that any of those 9,000 providers that have been disqualified from Medicaid for a whole host of reasons. So providers that are just providing really low quality, poor care, putting their patients at risk, putting their patients in danger, committing medical malpractice. And Planned Parenthood's theory is if a state makes that decision that this provider is not qualified and is going to be dangerous to its citizens and disqualifies them as a result of that, that one individual who's been to that provider one time in the past has a federal right to drag the state into federal court and force it to defend its decision to disqualify that provider. That position just doesn't make a lot of sense. Even we heard from Justice Barrett, she questioned the attorneys for Planned Parenthood and really asked them, how does it make sense that the system would be set up that way? And Planned Parenthood's attorneys just didn't have a good answer to that question.
I mean, you also have the issue, Planned Parenthood has become, I think, the nation's second largest trafficker in transgender facilitating drugs, hormones that they're providing, and in many cases to minors. And you have states like South Carolina that want to protect minors from this. So, I mean, it seems like the state would be forced to do something and support something that's at cross purposes with the laws that they've adopted and passed.
That's right. So we've known for years, obviously, that Planned Parenthood performs hundreds of thousands of abortions every year. They're very proud of that. They're very bold about proclaiming that, how many innocent lives they're taking every year. After Dobbs, what we saw from Planned Parenthood is that they doubled down on a radical political agenda, and now they're expanding, like you said, outside of just doing abortions. Now they're also providing these dangerous so-called gender transition drugs. They've become the second largest provider across the country. They've even admitted to providing these drugs to minors, sometimes with parental consent, sometimes finding ways around that. And so we're very concerned, and South Carolina has said, listen, taxpayers in our state should not be forced to fund a radical multi-billion-dollar organization that is so fundamentally at odds with the values and the priorities of our citizens. South Carolina is a pro-life state. South Carolina's leadership, Governor McMaster, has said, I want to make sure my citizens are protected and cared for, and that they receive the best and the highest quality health care that they can, even and especially those citizens in South Carolina who can't afford to pay for their own medical assistance and who are on Medicaid as a result. And so this case is about whether or not states will be free to redirect limited taxpayer resources away from activist organizations like Planned Parenthood that are advancing an agenda, and direct those taxpayer funds to providers offering comprehensive healthcare services and not performing abortions and not distributing these dangerous drugs to minors.
So, Chris, bottom line here is that as we anticipate the Trump administration moving more toward block grants when it comes to programs such as Medicaid, that the states will not be able to discern how to spend those monies in keeping with the values, as you pointed out, that South Carolina has. We'll ultimately have judges actually determining how these Medicaid dollars are spent.
Right, and that's what we've seen for decades in this area of the law, unfortunately, is that Congress, in passing the Medicaid Act, was very intentional that Congress wanted states to have discretion to decide which providers are qualified and which providers are disqualified. But unfortunately, thanks to some bad precedent and some bad lower court decisions, including the case that we're appealing, that discretion that Congress gave to the states, federal courts have been stealing that discretion for themselves, and they've been telling states like South Carolina, no, you have to fund organizations like Planned Parenthood. And South Carolina hasn't really had a say in that decision as a result of what the lower courts have said. So we're very hopeful and optimistic that the Supreme Court is going to issue a sweeping ruling that will free states across the country to say, no, our taxpayer dollars are not going to fund a radical organization like Planned Parenthood. We're going to fund providers that are actually offering real comprehensive healthcare services to the citizens who live in our state.
It's a far-reaching decision that the court could come up with. We just have about 30 seconds left. Chris, what's the timeline here? When do we think we'll have an opinion from the court?
So typically, the Supreme Court releases its opinions by the end of June. So we're expecting an opinion in this case by the end of June. We think, in the meantime, ADF is going to continue to get the word out that Planned Parenthood really isn't the healthcare provider that a lot of people out there think it is. It's not offering comprehensive care. It's mainly doubling down on this radical agenda of abortion and contraception and these dangerous so-called gender transition drugs. And states like South Carolina should be free to use their resources to best serve their citizens.
And we will pray to that end. Chris, thanks for joining us.